How do urodynamic studies work? Urodynamic studies are specialized tests that help evaluate how well the bladder, urethra, and the muscles and nerves associated with them work during the storage and releases of urine. These tests are particularly useful for diagnosing urinary problems, including those related to prostate conditions, such as prostate cancer or benign prostatic enlargement. These conditions can significantly affect urinary flow and bladder function. The process begins with preparation. Patients are typically asked to arrive with a full bladder. Initially, they will empty their bladder into a device that measures the urine flow rate, a test known as uroflowmetry. Next comes catheter insertion. Two thin, flexible tubes, called catheters, are inserted. One catheter goes into the bladder through the urethra, while the other is placed into the vagina or rectum. The bladder catheter is used to fill the bladder slowly with sterile water and to measure bladder pressure. The second catheter measures pressure in the abdomen. This helps distinguish between bladder muscle activity and changes in abdominal pressure. As the bladder fills, a phase called cystometry occurs. During this phase, pressure sensors record how the bladder muscle, known as the detrusor muscle, responds. Patients will report sensations of fullness and urgency. This part of the test assesses bladder capacity, compliance, and any involuntary contractions that might cause leakage. To further evaluate the situation, patients may be asked to perform provocative maneuvers. This could include coughing or bearing down, which helps assess sphincter function and identify triggers for stress incontinence or leakage. Once the bladder is full, the voiding phase begins. Patients are given permission to urinate while pressure and flow rates are recorded. This phase evaluates how well the bladder empties and how the muscles coordinate during urination. It can reveal issues like obstruction or weak bladder contractions, which are common in cases of prostate enlargement or cancer. In some cases, additional measurements may be taken using electromyography, which measures pelvic floor muscle activity. This provides insight into nerve and muscle coordination. The entire test usually lasts about an hour and is generally not painful, although some patients may experience discomfort or urgency. It is important to maintain patient privacy and comfort during the procedure, as anxiety can affect results. In the context of prostate health, urodynamic studies are invaluable. They help assess how conditions like prostate enlargement or cancer treatments impact urinary function. The studies can differentiate whether urinary symptoms arise from bladder dysfunction, obstruction from the prostate, or other causes, guiding appropriate management. Overall, urodynamic studies provide a detailed picture of lower urinary tract function. They measure pressures, volumes, flow rates, and muscle activity during both bladder filling and emptying phases. This information enables accurate diagnosis and tailored treatment of urinary problems related to prostate disease. Always consult with healthcare professionals for personalized medical advice regarding urodynamic studies and any urinary concerns.